to introduce our panelists tonight. And that is, we are honored to have State Senator Susan Talamantes Eggman with us today, who will be sharing what is happening at the state level with the MPOX response. Senator Eggman is a leader with decades of experience in public service and community building. Dr. Susan Talamantes Eggman was elected to the state Senate in November 2020, serving the 5th Senate District, which is comprised of San Joaquin County. Susan served in the State Assembly from December of 2012 through November of 2020. Prior to her service in the legislature, Susan served 6 years on the Stockton City Council. Susan is currently the chair of the Senate Budget Committee on Health and Human Services. We are also excited to have Tracy City Council member Dan Ariola with us today. Councilman Dan Ariola was elected to the Tracy City Council in 2018. He also works as Deputy District Attorney for San Joaquin County. At 29 years old, he became the first millennial, as well as the first openly LGBTQ elected official in the history of the city of Tracy. Councilmember Ariola has received national recognition on the 40 Best LGBTQ Lawyers Under 40 list by the National LGBTQ Bar Association and on the Young Elected Officials 35 Under 35 list by the YEO or the YEO network. Additionally, we have Isaiah, who is the Outreach Director of San Joaquin Pride Center and a representative from the University of the Pacific. And Public Health Officers of San Joaquin County, Dr. Maggie Park, will be opening us up today with a status update on MPOX in our county. So I will turn it over to Dr. Park.
Thank you, Melissa, and thank you everyone for joining us today, and a special thank you to our speakers. We're so grateful to have you here with us today. So a little history on monkeypox. Monkeypox was discovered first in 1958 in colonies of monkeys that were being kept for research in Copenhagen. And it wasn't really until 1970 that the first human case was discovered. And the name monkeypox did stick with it because of those monkeys, but we don't really know the original host or animal reservoir for this particular disease. And since we do find that the title can be a bit stigmatizing, I'm going to try my best to stick with MPOX as its name throughout the course of today. So there was an outbreak of MPOX in the Midwest section of our country back in 2003 with people who had contact with pet prairie dogs. There were some infected African rodents who were brought to our country, who then infected prairie dogs, who then infected humans. But that was short-lived and not really a big newsmaker back then. Really, up until this year, 2022, MPOX has only really been endemic in Central and West Africa. There have been some sporadic cases of MPOX in the UK, Singapore, Israel, and in our country between 2018 and 2021. But amongst people who were not really related to one another and who really could be traced back as having gotten it through travel to Nigeria. The case fatality rate for MPOX varies between 1% and 10%, but the current strain that's causing this current epidemic is a milder strain called the clade-2. And luckily, since it's milder, our fatality rate in this country is really more along the lines of 1% or even less, as you'll see. Since this is not a new virus, we do have treatment and vaccines available for it. Next slide. So the case count, the most recent count that we have in the United States is that we're at 26,194 total cases to date. And if you look at that map, the darker blue states are states that have had more than 500 confirmed cases of MPOX so far. And California is dark blue. Not only have we had more than 500 cases, we've had 5,000 total cases so far. 23 of those cases have been right here in San Joaquin County, 20 of them being males, and we've had 3 females. There have been no deaths in our county, but there have been 3 deaths in the United States so far, all occurring in patients who have some sort of immunocompromising condition. Overall, the risk to the general public does remain low. And I will say that the majority of cases in our state have been in LA County and San Francisco County. We've been kind of in the middle of that. Luckily, throughout the nation and the state, currently case counts are decreasing. Next slide. So what are the signs and symptoms of MPOX? And of course, it's that classic rash that you might have seen pictures of. And in the medical field, we call it macules, moving to papules, to vesicles, to pustules. But really, macule is a red, flat rash. That transitions to becoming a little bit of a bumped up rash. That then becomes a fluid-filled blister, which then might go on to the last stage, which is a blister that's fluid-filled, but the fluid is pus, so a pustule. These rashes can appear anywhere on the body, including the genitals. It could be localized to any particular area of the body. We're seeing a lot of cases in the United States in the anal genital areas, but it can be spread to other parts of the body, definitely the face, your arms, your legs, palms and soles of your feet and hands. And it can be mistaken sometimes for an STD such as syphilis or herpes or other sorts of common skin rashes like molluscum contagiosum in children. Usually preceding that rash, there will be some flu-like symptoms like the fever, headaches, muscle aches, and swollen lymph nodes. Sometimes those symptoms come after the rash, and sometimes those symptoms don't come at all, and people only have the rash and no other presentation. So all things are possible. Usually those symptoms start 5 to 21 days after a person is exposed to MPOX. And that person who does have MPOX can be infectious to others while their scabs are still there. Until the scabs fall off and a new layer of skin forms, you're still infectious. That can last 2 to 4 weeks duration. So what can you do if you've been exposed or you have symptoms? Well, first off, you want to call your healthcare provider, ask about testing, ask about vaccines. Later on, we'll also share the contact information to how you can get in touch with public health. We can help you through some of your questions. If you have symptoms, we want you to stay home, take a break from others. If you must be around others, please cover your rashes with clothing and wear a mask. And of course, we give you the California Department of Public Health's website because they've created a very nice monkeypox webpage. So stay informed. Next slide, please. So how does MPOX spread? Well, it spreads through close contact with someone else who has MPOX, usually skin-to-skin contact, so hugging, kissing, sexual and intimate activity. But it can also spread through fomites from sharing materials, bedding, clothing, towels, and perhaps through prolonged face-to-face contact, because we do know that it can be spread through respiratory droplets, so that if you have that prolonged face-to-face contact with someone, saliva, mucus, that can be a way of transmitting MPOX. But by far, far and above, what we're seeing through this current outbreak is that it's the direct skin-to-skin contact with a rash or a lesion or a scab. So how can you stay protected? Avoid intimate or physical contact with someone who has symptoms of MPOX. Be open in talking to your partners about intimacy and about symptoms. And of course, as we've said with COVID, throughout COVID, is to wash your hands, wash your hands. But in addition, wash any surfaces, bedding, towels, or clothing that might have come in contact with the fluids or the lesions and the scabs of MPOX. And next slide. As I said, case counts are decreasing, which is really great news, but of concern is that throughout the country, we have been seeing that some people have had very severe cases of MPOX requiring hospitalization. And as I said, there have been 3 deaths. So we do have treatment available for this particular disease. It's called tecovirimat or TPOXX. It is an antiviral drug that can be given intravenously in people who are sick enough to require hospitalization, but in general, it's being given as a pill that people take over 14 days. And it's being offered through the CDC's investigational new drug protocol. So your physician can apply through a particular CDC form to get TPOXX for you. We do have pre-positioned doses available at Public Health, so we could help your physician do that form and that paperwork and then make that drug available to you now. And we also have some pre-positioned doses available at San Joaquin Health Clinics and at community medical centers. It is a drug that is supposed to be reserved for people who are having a severe case of monkeypox or MPOX, or who are at risk for severe disease. There's also a vaccine available, which is called Jynneos, really available for anyone who considers themselves at high risk for developing a bad case of MPOX. And we'll show you this on another slide, but really we're doing this on Tuesdays at a vaccine clinic at Public Health, and anyone can register on myturn.ca.gov. And when you register on MyTurn, it's just a self-attestation process that says that you find yourself at risk for MPOX. There are some prioritization lists that I could share with you, but basically although when you get on MyTurn, you can see who the prioritization is for. Really, it's self-attestation in order to receive that vaccine. And we have plenty of supply at this time right now for anyone who needs to register. And I believe that was the end of my slides, Melissa. Thank you. I can't hear you, Melissa.
Right. Oh,
You
my
are.
goodness. So sorry about that. Oh, thank you so much, Dr. Park, for that information. And thank you, Senator Susan Talamantes Eggman, for being here with us this evening. And we would love to hear from you about what the MPOX efforts are at the state level.
Thank you very much. And thank you for inviting me. I think the first thing I want to say is, it's hard to find a silver lining from COVID, but I would say a silver lining from COVID is that public health is now just like a common thing we all think about, right? And we've all been, like Dr. Park and I have been in constant communication throughout the COVID crisis. And so when the next thing pops up, we were ready to go and had good relationships and communication. And I just like to do a plug for Dr. Park. She was my Woman of the Year for Senate District 5 last year for her fantastic and steadfast response. She's seen as a real state leader. And so we are very lucky to have her with us. So say that first. So thank you. And thank you for inviting me. And thank you for being proactive and having this, right? We're San Joaquin County. We're in the Valley. It's not generally one of the valleys you think about that's going to be proactive on an issue like MPOX. So thank you for doing that. So as Dr. Park intimated, the first cases we saw bigger evidence in places like San Francisco and Los Angeles. So I am a member of the LGBT Legislative Caucus. I'm the incoming chair, but Scott Wiener is the member who represents the San Francisco area, Senator Scott Wiener. And so he began talking about MPOX very early on. And so we put together a select committee to be able to have, so before, and it's crazy at the end of our legislative session, it's a lot of committee hearings, a lot going on, but we prioritized it and came together and put together a select committee and met with experts around, and by the very courageous council member also came forward, Dan Ariola, and presented before the group. So with that, and just being able to continue, and that was a bipartisan, Republicans and Democrats and members of the health committee, and then also members who just wanted to be a part, to be able to really dedicate that. And so the LGBT caucus really leaned into it, and were able to secure $41.3 million to be able to be voted on basically the last day of session for public health, and to be able to deal with putting that money out to the local public health agencies to be able to pay for reimbursement for folks, for insurance, for cost expended. As we're going into Pride season, we want people to know that, while not perfect, we've had a robust rollout, and we continue to have information out. I was at the Stockton Pride Center 2 weeks ago for the Pride event, and there was MPOX out there. And I was just at Stanislaus County Mo Pride this last weekend, and there was Stanislaus County was out there. People were out there giving the MPOX vaccine. So it's out there at the Pride event. So that's a good place to go if you want to be able to get your vaccines. But public health is the place to be able to do that. So as a member of leadership of the LGBT caucus, I have staff caucus staff that then has been in conversations with pride centers, with community organizations, with public health districts all over the state to how do we bridge efforts? What more do we need? What should our budget ask be as we're going into next year? And I think it's just important to note that while this is happening right now, you have LGBT leaders at the city level, at the state level, really advocating and saying, let's not let this be another HIV crisis like we suffered in the 80s, when there was not one person at the state, local, or federal level who was an out person willing to say, hey, this is an emergency, we have to pay attention to it. And, hundreds of thousands, millions of people died. And so we have been, not sitting idly back. And so thank you to everybody who's tuned in tonight to educate yourself, to maybe take on a leadership role in getting information out about the very effective vaccines we have, and for people to be able to practice safely, as we always encourage you to do, and continue to use me as a statewide partner, as a resource, in addition to turning out to our very fantastic San Joaquin County Public Health. Thank you very much.
Thank you so very much, Senator Eggman. We truly appreciate you. So now we're very happy to have our next panelist with us, and that is Tracy City Council Member Dan Ariola. Mr. Ariola, please share with us your story.
Thank you, Melissa, and good evening, everybody. Thanks for joining us tonight, and thank you for the shout out, Senator Eggman. Always a pleasure working with you. First and foremost, I do just want to take a moment to thank Dr. Park, thank the entire team at Public Health. Ultimately, from early on, Dr. Park was organized, the team was organized, incredibly proactive, and especially coming out of the COVID crisis. There were lessons to be learned, and those lessons were learned and they were implemented. There were some challenges, definitely some barriers, but the team here in San Joaquin County did incredible work, and I thank you so much for everything that you've done. So my story was a little bit different. So unfortunately, I was one of those individuals who tested positive very early on for monkeypox. I had attempted to get vaccinated early on, but unfortunately in San Joaquin County, we didn't have the number to preventatively offer the vaccine. They were reserved for close contacts of confirmed cases, so I wasn't able to get the access I needed. And that was something that I discovered was the same or similar in every county throughout the Central Valley. So unfortunately, I tested positive, and it was a very new thing, pretty scary actually. At the time I talked to my primary care provider, who didn't have the testing materials, who was unfamiliar with the symptoms, was sent over to the emergency room. Had a team there, Tracy Sutter, who had to go and research, exactly how to perform the necessary testing, and kind of going back and forth, reading to do their own research. Ultimately, it took, I think it was something like 4 or 5 days to get my results. And at that time, I was very, very nervous, but spoke immediately with Public Health and was in constant communication with them, my primary care physician, and infectious disease specialist, pharmacist. I feel like I had my whole team. It was like a TV show. But the challenging thing for me was, so I had a partner who obviously was an exposed contact to me. And so my partner was unable to access the vaccine, despite the fact that he was a close contact. And so that's what I remember from those early on, was for him living in Alameda County, having to go through and work with various hospitals, working with Public Health in Alameda, send him over to Contra Costa, back and forth. And ultimately him, being incredibly frustrated and nervous. And so me having to advocate here locally to see if he could get one of the original doses. And he did, and I'm so appreciative of that. But then beyond that, I remember trying to access the antivirals, TPOXX, and it taking quite a bit of time, and there being so much red tape, and there was confusion with the pharmacist and the infectious disease specialist. And I think it was just early on, there was definitely some growing pains that we had to do to fix. But from what I understand now, things are running much smoother. But, early on, it was challenging, it was scary. And I remember then that I was on quarantine for 3 weeks. Let me tell you, I'm not one of those people that likes to be on quarantine for any amount of time. And so I tried to use my time effectively. And at the time, I was the president of the League of California Cities LGBTQ caucus. And so I started to do outreach and reaching out to all the Pride centers throughout the state that were located outside of LA and San Francisco, where the most resources were being allocated, to see, what was going on the ground, what people's experiences were. And I had a really great opportunity to work with Stonewall organizations, with Pride centers. And I heard just more and more that my experience was very common, especially early on. And so that's when I had reached out to Senator Scott Wiener and saying, what can we do to gain some access in the Central Valley? And I reached out to Senator Eggman's office. And so that's when I was asked to testify. And I think that one of the great things that came out of that was what I hope to be a lessening of the stigma. And I think the stigma is so great and it is so challenging. And it's something that we continue to see for the LGBTQ community in the Central Valley. It's not just in access to medical resources. We see in access, to victim services. It's something that we consistently see that we need to work on, is kind of expanding the cultural change for greater acceptance. And we're getting there. We are absolutely getting there, but I still think that we have quite a bit of work to do. For me, unfortunately, after my testimony, I received quite a bit amount of threats. I had to have some extra police patrols from the Tracy Police, but I'm so thankful for that. But ultimately, we are in a very different place now. And I'm glad that we're able to have these conversations to reduce the stigma, to reduce those fears and hesitations, because realistically, we had this bubble in time where if we could vaccinate the members of our community who are the most likely to be exposed, we could prevent it from getting into the general public. And ultimately, I think we have, maintained this very well. And I think that was the goal. And it touches my heart truly to see our folks in San Joaquin County, especially, doing the work and working alongside us. But to see just kind of these incredible stories of LGBTQ community leaders, like our Pride centers, and our Stonewall groups who really did the work. And it's something that I wasn't around during the original HIV/AIDS crisis, but I read stories and I read books about it, and I talk to folks who lived through it. And it's ultimately, as a community, we're missing almost an entire generation of folks. And so it's tough to learn lessons when we're missing some of that mentorship. And so I'm glad that we as a community stepped up for one another, and we stopped. And even during Pride Month, people took precautions and they took care of one another. And public health centers throughout the Central Valley, especially San Joaquin County, allowed us to do that. So thank you for that ability for us to step up. And, I always think of the stories I hear from the HIV/AIDS crisis, where it was like lesbian women who stepped up and took care of gay men. And those are the lessons that we have learned. And I'm so glad that we've remembered that. And I think it's something that we should honor those folks when we are in need that stepped up. And this time around, the LGBTQ community absolutely stepped up for one another. But I do want to highlight and thank the work of our public health employees throughout the state who stepped up and absolutely provided us with the framework to engage in that outreach and ultimately limit this to something that is something that we can deal with. So I had a tough experience, but we have come out the better for it. And I'm glad that I was able to help in any way that I could. And I just really want to express, from my heart, how much I want to thank everything that you've done. And I appreciate everything you've done over the past year. So thank you.
Well, thank you so much, Councilman Ariola. We appreciate that so very much, and really thankful that you're okay and that you're healthy and ready to take this on. Truly appreciate it. Next up is the San Joaquin County Pride Center. We want to thank them for their partnership throughout this past few months. So Isaiah, I turn it over to you.
Well, thank you for having me. And also from the bottom of my heart and on behalf of the San Joaquin Pride Center, thank you, San Joaquin Public Health, for doing all the hard work and the dedication to helping our community provide safety and awareness about MPOX. We help spread that information and I have to give major props to our social media director, Atlas. They are the ones that do constant updates regarding health and other things. And it is no small part through getting that information out that it is that is with great honor so that I can thank. All right. As Senator Eggman said, we had a MPOX clinic at our last San Joaquin Pride festival, I believe around 2 weeks ago on Sunday, September 25th. We wanted to try to do our part to basically take care of our community. And one of the biggest things that we've always tried to do about this is try to eliminate stigma about MPOX and the LGBT community, specifically towards gay and bisexual men. They're the ones that seem to be having the most type of stigma. We do not want to have, we're trying to eliminate that to not have a parallel of the AIDS epidemic all the way back into the 80s, and the ramifications are still felt today. We also always try to find ways to help take care of our community. We offer support groups here at the center. We have our men's group, women's group, and our transform group. We try to spread as much information about it as possible because it's not a quote unquote gay disease, just like how the AIDS epidemic was started in the 80s. It's actually very dangerous thinking that thinking it's just a gay disease, like, oh, when one person who is straight and cis doesn't feel at all threatened about it. But in reality, they also need to be just as careful, be able to take precautions and be able to take this seriously. I'm fortunate enough to be vaccinated. I remember going to my first vaccination appointment for MPOX put on by San Joaquin Public Health, so thank you very much. Along with my coworkers as well. Standing in the line leading up to the appointment, I felt almost a part of history, but not in the best way possible. I looked around me and there was approximately over 50 other individuals, members of my community that were there, and I could see some of the concern on their faces. Some of them were wondering, some of them were on the ground and rocking. And that always struck the chord with me. Like I said, I'm fortunate enough to be vaccinated at a time where MPOX is the development for MPOX has been, thankfully developed. But we must all do our part to help protect our community.
Thank you so much, Isaiah. We truly appreciate your being here with us and all that you are doing for your community and for our community here in San Joaquin County. Thank you so very much. And finally, we're going to hear from Josh O'Connor from the University of the Pacific regarding efforts on campus and communal living. He is in charge, I believe, of the residential life and of the student body there. And Josh?
Well, thank you, Melissa. Hello, everybody. My name is Josh O'Connor. I'm the Executive Director of Student Life. I have my colleagues, Maria Blandisi and Regina, also on the call as well. Thank you for inviting us. Obviously, we want to make sure that we are reaching out to our youth and our college students. So we are doing a large educational campaign to our student body, making sure that they are aware of monkeypox, how it is spread, and making sure that we are providing a good self-awareness campaign, very similarly to what we did with COVID, of the risks and how it is spread, and what they can do to protect themselves and other community members. We are really, really happy and proud to be a campus that can offer vaccines both to the community and to our student body. And Regina, my colleague here, is the director of our health center, and we will be offering, the Student Health Center will be offering vaccines to our students and campus community. And our School of Pharmacy will be offering vaccines to the general Stockton community. We also have a plan in place that if monkeypox does have an outbreak here on our campus, we have an isolation plan in place to keep our community safe, reduce the spread. We've got a lot of experience, friends, from COVID. So we've got the plan down, and we are ready to take this on, reduce the spread, and really educate both our student body, our faculty and staff, but also the Stockton community. Maria, Regina, anything else that you would like to add, please?
I just want to, I wouldn't forgive myself if I wasn't able to tell Dr. Parks, thank you for all that you've helped us with. I recently came from San Joaquin General Hospital, so you can imagine how you made a difference for us. We depended on you day in and day out. I'd watch those board of supervisor meetings, and I would think, you're probably going to get in your car and drive so far away from San Joaquin County after this meeting, the way they drilled and grilled you. So we're just blessed to have you as part of the team. So thank you and your team. And as Josh said, we're trying to be very proactive, just like Senator Eggman spoke about. That's our goal. We're talking to students when they come into the Student Health Center for regular visits, talking to them about monkeypox, trying to attack that stigma that Isaiah mentioned, and make them know that we're here. We're here for all of them, and so they can come in if they have any questions, any concerns. We'll take walk-ins to look at any rashes, anything that's going on with the students. So that's what we're trying to do there.
And I'll just jump in, Regina and Josh. I'm Maria Blandisi. I'm our Vice President for Student Life. So we care about the well-being of our students inside and outside the classroom. And in addition to Regina's expertise leading our Student Health Center and Josh leading the expertise in the congregate living facilities, we also have our colleague Mario Enriquez with us, who leads the Center for Identity Involvement, which oversees our LGBTQ campus resources for that community as well. So I know Mario was on camera previously, but we want to make sure that everyone hears. There he is. If you want to chime in, Mario, as well, I think it's important to just acknowledge that we gather communities in lots of different ways with the intention, right, that we will hit students and young adults at different moments at different times, and we're all effective in different ways in meeting their needs and reaching out to them. So, Mario, if I can just pull you into the conversation as well, because I know you're doing a lot of work to kind of make sure that community feels safe and protected and aware.
Absolutely. Yeah. Hi, everyone. Thank you again. It's good to be here. As Maria mentioned, my name is Mario Enriquez. And yes, for our center here at Identity and Inclusion, we have a lot of new students who are coming back from COVID, a lot of in-person gatherings. So we are making sure that we are primarily targeting, especially our LGBTQ students, our young students who are people of color, really building out these spaces and having these conversations for them as well, just to, again, right, break down that stigma and have those more intimate conversations and provide resources with San Joaquin County Health, as well as our San Joaquin Pride Center as well. So thank you all for this discussion.
All right. Oh, we thank you so much from all of our panelists that have been here tonight. So as we move on to the Q&A portion of the town hall, we ask that our panelists stay on to help with any questions that might be asked. This is the time where we invite you to put any questions you have in the chat box or virtually raise your hand so we may answer your questions live. and until we even have those questions, I have one actually that I was curious about from Councilman Ariola, and I was just wondering, once you were found positive, what would be your advice to somebody who is getting this diagnosis? What would your advice be for the next steps?
Sure. Take a moment and breathe. I think that was the first thing. It really was early on. We didn't have a lot of data to work with. And I remember my first call with the public health nurse. I was scared. I was nervous, and I was just like, she's like, "Are you okay?" I was like, "I don't know." And she told me okay, well, just take a breath. And she's like, "We're here for you." And I was like, "Okay." So I think first things first, take a breath and recognize that the resources and the framework for access are here now. And so I think that a lot of those hiccups and barriers have been overcome. So if you are someone who has tested positive, just recognize and realize that we have better data now, we have better access to treatment, and that ultimately, hopefully the stigma has been reduced somewhat, and it's not as negative, and just take the time to take care of yourself. And I think that that's what's so special about the LGBTQ community, is that we recognize that we fight for each other, we support one another, but sometimes it's tough to take care of yourself. And so, just knowing and recognizing that by taking a little bit of time to quarantine, to do what you need to do, ultimately you are protecting our LGBTQ community, or protecting San Joaquin County, and especially with the moments of isolation, that we have so much more access now, and those things were lessons learned from COVID. So just know that lessons are learned, things will be okay, and we're all here to support you along the way.
Thank you so much, Councilman. I love that advice. Just breathe first. The rest will then seek medical treatment, period. Thank you. Let's see, do we have any other questions in the chat?
Nothing in the chat, but I did want to ask Dr. Park a question, because I've gotten this a lot when doing outreach. What are the side effects typically with the Jynneos vaccine?
Oh, yeah, that's a great question. So most people do just fine with it. It is an intradermally given vaccine. In the very beginning, some people were getting it subcutaneous, so a shot in the arm, but now it's kind of like a PPD or a TB skin test, where there's a small needle that just goes right under the skin. And so the most common side effects really are that you're going to be itchy after that. It's that little bubble that gets made under your skin. So redness, local inflammation, itchiness are the most common. I don't know if that was a good enough answer. There are some people who do get some fatigue and chills from it, and there are contraindications. It is made with chicken embryos, so there are just a few people who probably should not get Jynneos, and that is people who are allergic to chicken or eggs. And then, of course, there are a couple of vaccines like gentamicin and ciprofloxacin. If you happen to be allergic to those, you shouldn't get those, the Jynneos vaccine. So in the rare case you don't know you have that allergy, you could have a severe allergic reaction to the monkeypox or MPX vaccine called Jynneos. But it's very, very rare. And so really it is mostly that the local skin findings. A little bit irritating, that's all.
Thank you, Dr. Park. I was wondering if you could talk a little bit about who is eligible for the vaccine.
Sure. So, actually, let me read to you what the California Department of Public Health says about who is eligible for the vaccine. Right now, the prioritization group is any man or trans person who has sex with men or trans persons, any man or trans person who is taking or is eligible for HIV PrEP, anyone living with HIV, particularly those with a CD4 count less than 350, an unsuppressed HIV viral load, or an opportunistic infection. Healthcare workers who are likely to collect laboratory specimens from a person with MPOX. People who have had any of the following in the past 6 months: sex at a commercial sex venue or sex in association with a large public event in a geographic area where monkeypox transmission is occurring, or sexual partners of people who are at risk or people who anticipate experiencing any of those risks that I just listed. So that's the official list of people who are eligible to get that Jynneos vaccine. But as I said, right now, the state as well as the CDC has really opened it up to what we call pre-exposure prophylaxis, meaning before you're even exposed to a case of MPOX, if you feel you're at high risk, you can probably get that vaccine. This is kind of a prioritization list, the list I just read to you, but as I said, we don't have a shortage currently, so you don't really have to attest that you're one of those groups of people. If you get on the myturn.ca.gov website and register for a vaccine with us, you're just attesting that you find yourself at high risk, that you are concerned and you think that yourself is at high risk, and we will vaccinate those who attest to that.
Thank you, Dr. Park. I did want to open it up to panelists or anyone else on the call. If there are any questions that you all are hearing from the community, we have Dr. Park on here, so it would be great to be able to address that. So yeah, go ahead and put it in the chat or unmute yourselves.
Well, I have a question, Dr. Park. So what if you think that you were exposed to monkeypox? I mean, really, is it too late? What do I do now?
Well, if you think you're exposed to monkeypox, of course, as I said earlier today, you want to contact your healthcare provider. You could also contact public health. And really, if you're quite certain you've been exposed to monkeypox, you should really be seeking that vaccine out. If you can get the vaccine within 4 days, you'll have the best result. But even getting it within 14 days of that exposure event should really help to decrease the severity were you to develop MPOX disease. So first and foremost, get that vaccine, get it within 14 days, the earlier the better. And then, of course, if you start experiencing any of the symptoms that we mentioned, you want to find a healthcare provider who can get your swabbing done. Swabbing meaning taking a Q-tip, a particular type of swab that we use to swab the lesions. And other than that, if you're developing symptoms, of course, we ask that you stay home. Other than seeing your healthcare provider, getting yourself tested, getting yourself vaccinated, try to stay home if you can.
If there aren't any.
Dr. Park, I had a question. I know early on we didn't have as much data. I'm curious if we have any additional data now about the longevity of the vaccine itself. How long does the immunity period last? Do we have any more information about that?
Yeah, that's a great question, and it's being very actively studied right now. There's a lot of folks in the country now who have had one dose and maybe haven't had their second dose yet. That second dose is 28 days after the first dose, and then technically you're considered fully vaccinated 14 days after you get your second dose. So now we're just moving as a country into having a lot of fully vaccinated people finally that we can study and see the longevity of the vaccine. So it's kind of an unknown for right now. But I do believe it should take the majority of us through this current pandemic or outbreak. So getting a vaccine now hopefully will take us through what we're currently experiencing. There was one very new CDC article, a study posted. It's called the CDC MMWR, and it's an article based on a study that was done on 18 to 49-year-olds who did get the Jynneos vaccine. They were studied 14 days after just one dose. And even after just one dose, they had a 14 times less chance of developing MPOX compared to those who were not vaccinated. So already seeing some good data out of some preliminary studies.
Thank you.
Something, Dr. Park, that we get asked a lot is, can someone get the flu shot or their COVID vaccine at the same time as getting the MPOX vaccine?
You certainly can. There's definitely no contraindication to getting the COVID and the flu on the same day, or with the Jynneos on the same day even. For purposes of, local inflammation, pain, swelling, you might want to do them in separate arms. And of course, the Jynneos is in the forearm because it's intradermal. There's one little caveat to that, and that is that there's this small theoretical risk of getting myocarditis or pericarditis from the Jynneos vaccine or from one of the COVID vaccines. And so to get both of them together might increase your risk a little bit. And so young adolescent males and young adult males can consider delaying the COVID vaccine 4 weeks after the MPOX vaccine. You don't have to delay, you can get them together. But if you're in that category of a young male, because of that really slight theoretical risk, you might want to delay and get your COVID vaccine 4 weeks after your monkeypox vaccine. But flu and COVID together, no issues really.
We just got a question in the chat. What should you do if you get a call from public health about possible exposure?
So we, just like with COVID, we are doing that. We're calling people based on contact tracing. So if we have a person with MPOX, we're going to call them and ask them, who might you have given MPOX to? Who was exposed to you? And if they reveal who that person is, yes, you might get that call and find out that you had an exposure to someone, but we will walk you through that for sure. I mean, we're going to ask you about your symptomatology. How are you feeling? Are you vaccinated? Are you interested in a vaccine? And this is really where we can even offer on a case-by-case basis the vaccine to young children who might live with somebody who has MPOX. And that's why you see that vaccine on a case-by-case basis can be offered to the very youngest of children. So we will find out all of that and walk you through it.
With that being said, Dr. Park, when we contact those people, do we give, I mean, there's a privacy issue here, isn't there? I mean, are we concerned about who knows what other people's medical things are?
Similar to COVID, of course, we're always concerned and we do protect everyone's privacy. We don't say, John Doe told me that he might have given you MPOX. We just call and say, you might have been exposed to MPOX. How are you feeling? And are you interested in a vaccine? And those folks don't necessarily have to register for a vaccine on a vaccine day. We've been just having them come in on their own to public health, and we've been vaccinating those who want it. Of course, it's their choice, but privacy of this is of utmost concern, and we do our best to protect it. So that sort of information is really not given in these calls.
I do have one more question that I wanted to ask. So another thing that we hear often from the community is that if someone has received the smallpox vaccine when they were younger, do they have protection against MPOX?
Yeah, that question has been asked a lot. And to be honest with you, we don't have a clear answer to that yet. Theoretically, it's possible that someone who had the smallpox vaccine, which was available, up until 1972, could have some lasting duration of immunity, and that immunity might not just be against smallpox, but could give them some immunity against Mpox. But what we know from vaccines is that a lot of time that immunity wanes, so we can't really feel secure that having had a smallpox vaccine so many years ago is protective. And we encourage those who feel that they're at risk to go ahead and get that Mpox vaccine on top of it. So not a whole lot known. Likely that your vaccination has kind of waned, and so go ahead and get the Jynneos.
Dr. Park, was wondering as well, are we concerned at all about Mpox spreading to animals like we were hearing about with COVID?
Yeah, as I said, there were examples of prairie dogs in 2003 who had it and gave it to humans, and we know that rodents and squirrels, and there have been other hosts. There have been other animal vectors. So certainly, even in the United States, we've had some incidences of people saying that their pets have tested positive. So we know it can happen. So a pet can give a human Mpox and vice versa. A human can give their pet Mpox. So it can happen. I think it's quite rare, but if you happen to be a person with Mpox, if your pet has not been exposed to you yet, the advice is that you ask somebody else, a friend or family member, to take care of your pet while you're recovering. Of course, if your pet needs to live in the home with you and you need to care for your pet, you do your best to clean their dish, stay away, cover your rashes, all that you can do to not give it to your pet.
Okay, I'd like to give a last opportunity to anybody to ask any other questions of any of the panelists. This is a great opportunity. You don't often have all of these experts at your disposal, but now is the time. So please, if you have anyone. Okay. Well, Maria, did you have something? Anybody? No? I think we were just very thorough. That must have been it, right? Okay. Well, that will wrap up our Q&A portion of the town hall. And if you would like to learn more about Mpox in our county, we really encourage you to visit our website. It is sjcphs.org, and we have an Mpox page there. If you're interested in making an appointment to receive an Mpox vaccine, please visit myturn.ca.gov. More resources on Mpox can be found at the cdph.ca.gov website as well. There are a lot of resources there as well. Tremendous amount. We use a lot of them ourselves. If you have any further questions, please contact our public health at 209-468-3820, or you can email us at sjc_iz@sjcphs.org. We are here to help. We here at Public Health want to make sure that we are giving out the most accurate and helpful information we can. So please feel free to email, call, come on down at our Hazleton facility. And with that, I'd really like to thank our wonderful panelists and thank you who has joined us this evening. And I hope you have a wonderful rest of your day.
Thank you, everyone.
Thank you
for having us.
Thank you very much.
Thank you.